Lung cancer is the number one killer among all cancers. It's not breast, colon, pancreas. Rather, it kills more people than all these cancers combined.
But to illustrate that the necessity of public education on COPD is there. Now, everyone out there already know what COVID is all about. But few are aware of a disease called COPD, which claims more lives than respiratory infections, COVID or not, each year.
So why does lung cancer get diagnosed in the late stages only? What's the reason? The reason is that we do not have population-based lung cancer screening guidelines. We have guidelines for breast cancer, for example, like regular mammogram. We have guidelines for cervical cancer, like regular pap smear. We have guidelines for colon cancer, like yearly or 2-yearly colonoscopy, but there is no such guideline for lung cancer. Most of the time, lung cancer gets diagnosed. When it gets diagnosed at an early stage, it only gets diagnosed by chance, not by choice. For example, patient may go for pre-employment health check and then the X-ray may pick up a lung cancer instead. Patient may go for personal health screening and they may find that actually patient has lung cancer. But look at the criteria for these guidelines. If you were to screen somebody for lung cancer in such a population, if you need to have a criteria of age group of 55 to 74 years old, and the person should have been a chronic smoker or quit smoking previously. Now, for example, in Singapore, let's say 40% of lung cancer patients are never smokers, and that's true for Asian or most Asian countries. Also, the age group of people getting lung cancer in Asian countries is much younger. So if we were to use these guidelines to screen patients with lung cancer in Asian population, we are going to miss 40% of people because we are not even going to screen them. So that's why we can't apply the USA guidelines on Asian population. We need our own guidelines, which we don't have yet. So that's the reason we don't have population-based screening for lung cancer yet for Asian countries. So how to diagnose or pick up a lung cancer? So there are broadly two methods. One is a CT scan, which raises a suspicion and which guides whether patient needs a biopsy and from where to do the biopsy. And the second thing is the biopsy itself, which is nothing but taking out a tissue from that abnormal area in the lungs. Now, is chest X-ray a reliable test for lung cancer? You can see on this slide, there is an X-ray of the patient and there is a CT scan of the patient. And if you notice, there is a nodule detectable on the CT scan on the right-hand side, but there is nothing detectable on the X-ray. So X-ray is not a reliable test for lung cancer. Now, women specifically in Asian countries are at a greater risk of getting lung cancer compared to men. So what's the reason for that? One of the reasons is that women have hormone estrogen, as we know. And because by virtue of this estrogen hormone, they are unable to repair the damage in their DNA as compared to men. Women can get cancer, lung cancer, by smoking fewer cigarettes. Now, can you get lung cancer without smoking? So we all know that lung cancer is a smoking-related disease. However, the research is showing that actually a lot of never smokers are getting lung cancer. So globally, about 25% of lung cancer patients are never smoker. However, in Asian countries, that number is 40%.
COPD is an illness predominantly caused by cigarette smoking that affects the respiratory system, gradually narrowing the air passages and reducing the ability of our lungs to process the air that we need from the environment. The answer is no, because it is not just one single factor of the amount or duration of smoking. There is a combination of risk factors that determines who develops COPD. It also depends on whether you have managed to attain your best potential lung function at adulthood. So unless you know what trajectory your lung function is going to take and can predict your potential of developing COPD later, it is best to avoid all known risk factors of COPD, especially smoking and air pollution, as much as possible. The worst aspects of their condition, as testified by COPD patients themselves, are breathlessness and the limitation of physical activity. In order to improve patients' condition, it is important that patients try to improve their lung function as much as possible by the use of effective inhaled bronchodilator medication while simultaneously increasing their exercise capacity via exercise training. Remember, physical activity is most important in prolonging survival in COPD.
Okay, I think there's a member of the public who asks what exercise would be good to prevent or help with breathlessness in COPD.
The best form of exercise is the aerobic exercises that involve the lower limbs. Example, walking, cycling, climbing stairs. If you are sedentary and have not been exercising, start with simply recording and increasing the number of steps you take daily.